Hiya, this module pretty much summarises the whole hair transplant process. It's got a lot of tricks and tips in it that I've learned along the way and that I've learned from numerous other guys that have had hair restoration procedures, from pre-op tips, post-op tips, airport security tips, staple removal, various information that you may well, despite doing a great deal of research, might not have thought of the relevant questions that are covered in this module. And I can pretty much guarantee it will help answer a number of questions and will certainly guide you effectively. I hope you find it of use, and obviously if you've got any other questions, feel free to drop me an email. I'll gladly help. Here's a variety of hair transplant tips within this module that I've put together over the years to help inform new guys venturing into their own journeys with hair transplants. You'll find numerous tips of before and after just to help you along the way. And they are very important little tips, and many guys have found them of great use over the years via the different forums. Stay local to your hair transplant clinic. I'm sure your hair transplant clinic will offer a range of hotels, and it's very important that you're close by to your hair transplant clinic. Get to the clinic early in order to not be rushed on the day of your surgery, to allow ample time to go through everything with your doctor. Have a list of questions for the doctor that you want answering the morning of your surgery. Rather than trying to remember them all in your head, it'll be impossible. Take 2 loose hats with you, as one might just not fit, and it's important that you have a hat to walk out the surgery with, because you'll feel a lot more confident, and obviously it will enable you to get away with the fact that you've had surgery. Take a travel pillow. These are very handy, especially for your journey home on the plane, as you can rest your neck and rest assured you'll be protecting your head. Get to bed early the night before your surgery. Aided sleep is advisable, because it's very important that you go into your surgery not only mentally strong but physically strong as well. Maybe get a massage the day before, as this will allow you to relax and potentially aid a good night's sleep before. Wear a button-up shirt the day of the surgery, as this means you don't have to take everything over your head. It's easy to get on and off. You don't want to be taking anything over your head once you've had hair transplant. Avoid alcohol, vitamins and minoxidil, a minimum of 7 days pre-op, as these can thin the blood out, which obviously makes surgery much more difficult to perform. Wash your hair the morning of the surgery prior to going in to see, so the doctor can see your hair in its natural state. Make sure you've made a story very clear to the various people you interact with, and my best advice is to say that you're going to be away for the next 2, 3, 4 weeks on holiday. Therefore, you avoid any speculation, anyone knowing you've had a hair transplant. Make damn sure you've got your Vicodin painkiller prescription filled out before you go for your hair transplant. Speak to your individual clinic. They will get you the prescription well in advance. Overseas patients will be given their prescriptions and painkillers at the point of surgery. I would advise taking the painkillers regularly, and this is a point for post-op, because even before the pain kicks in, remember, it takes 30 minutes for painkillers to even start working. So make sure you get a good overlap there between the painkillers and when the pain kicks in. Just monitor it and be conscientious with your painkillers. Have the clinic take lots of pre-op pictures in order so that you've got a controlled comparison for post-op. It's really vital that you've got a really good, clear pre-op situation to compare to as time evolves, because then you can see how far you've actually developed. Have the doc wash your hair the day after surgery. It does help reduce scabbing, keeps it clean, and then you won't be spending the next 2 weeks agonising whether or not you've washed your hair right initially. It's advisable to just speak with your clinic the day of your surgery and organise a post-op wash. Read the post-op instructions before you've actually had your hair transplant. Write down any key questions and tick them off before you leave surgery. It's easy to forget to ask once you're under the influence of all the injections and the painkillers. Just ask your clinic for your post-op instructions in advance. Consider wearing a bandana as well as a hat because it's often more comfortable than a baseball hat and it often covers more of the head. Remember, bring button-up shirts. Turn up in a button-up shirt and it's easy to take off and you don't have to take anything over your head because once you've had a hair transplant in the initial stages, it's advisable not to touch it. Take along with you some form of iPod, MP3 or CD player as therefore you can listen to your own music and help pass the surgery time. What do I need to do after surgery? Many common questions are answered here. Never underestimate the recovery time needed. Get the absolute maximum amount of time off work you can. You will feel fine after a couple of days, but you will look terrible. Aesthetically, you will not be confident, but just take as much time off work as you can realistically in order to get away with actually having had a hair transplant. It's not so bad if you can wear a cap for obvious reasons, but I also recommend you remove all mirrors from your house, car, office. Seriously, you will be forever scrutinising your hair transplant in the first few weeks, so I would highly recommend please remove as many mirrors as you can. Sleep upright, 45-degree angle initially to help aid the swelling, as then the saline solution that will have been pumped into your scalp will ultimately then be able to drift down your face much more appropriately and it will not hang around too long. Apply huge amounts of aloe vera to both the donor and recipient area 5 days post-op. I would highly recommend aloe vera as it really helps soothe the redness with me and I've heard many guys speak about it positively. Distilled witch hazel also helps soothe the redness and you can apply this a week post-op. Also get on MSM as it makes hair grow faster and will increase blood supply to your head. Drink lots of water and fluids. This goes without saying. Keep hydrated. Make sure you bend at the knees for the first 3 to 4 days and don't put your head under any pressure it doesn't need to be under. The first 3 or 4 days, just put shampoo in a cup and pour it over the recipient and donor area. Then build up to the shower, but shield your recipient area with your hand and dab on shampoo. Just respect your recent hair transplant. Rest as much as possible and respect it, as I just said. It's very important that you appreciate what's gone into your recent surgery, so just respect it. No physical activity for 10 days minimum and then build up to it approximately 2 weeks post-op. Don't be in too much of a rush to get back in the gym. Oh yeah, and stop staring in the mirror all the time. Start minoxidil if you want, as this has been proven to help speed up growth. Stop inspecting the scar on the donor area all the time. It takes months to fade, so it's all in vain looking at it all the time, okay? Just be patient. Put the hair transplant completely on the back burner now for at least 4 to 5 months, okay? It's going to take a long time to heal and it's going to take a really long time for the growth to even start. Take some clear pictures to compare your situation at various stages throughout. I would recommend get a controlled environment and every month just take a picture in exactly the same condition and therefore it will allow you to compare quite accurately. How do I get back through airport security? Another very common question. The best way to do this is to make sure there is nothing on you that can slow down your smooth passage through security, i.e. remove all items on you such as your watch, your keys, loose change, bangles, chains, anything that can cause you to bleep. As you walk through, remove your cap casually and calmly. They will not specifically be looking at your head at all. You will be ultra paranoid. They, meanwhile, will not even give you a second thought, only if you bleep, okay? So maybe they'll glance at you, and once you're through, there'll be literally nothing to worry about, and then just literally pop your cap straight back on your head. End of. You will never ever see these security guys again. So who really gives at the end of the day if he suspects you've had a hair transplant, you know? The people behind you will be stressing out, and they'll all be taking all their stuff off, and they'll all be, you know what it's like at airport security, it's a nightmare. So just suck it up, walk straight through, take your cap off, cap back on. It's not an issue. Another alternative, if you really are ultra paranoid, is you can always ask the security guard for a private room, you know. But to be honest, this really just is not needed. Do not big airport security up to be something that it isn't. Please, I have travelled through airport security with various hair transplants, and it's a non-issue. How long does the redness last post-op? Well, post-op redness will occur in both the recipient and the donor areas. The degree and length of time in which both areas will remain pink or red will largely depend on you, the individual's skin tone and healing capabilities. Redness in the recipient area occurs due to the presence of newly formed blood vessels and inflammation from the placement of the new grafts. Redness in the donor area occurs where the strip has been removed, and it's basically a wound that will eventually heal. So you can't rush these things. Mother Nature will ultimately work in her own good time. Once the wound of the scar is fully healed, and it takes several months, the scar should appear as a thin pencil line. It will be white and be very difficult to actually locate it. So it's very important that when you've had this surgery, you do not scrutinize it, you do not touch it, you do not finger it, okay? It's very important. The skillful surgeons have done the best of their ability to enable you to get the best result from your scar. So leave it well alone. For individuals with a larger degree of hair loss, the redness will be more apparent than those who've had a small area done. So camouflaging this area can be slightly more difficult. But if you can use existing hair to cover the areas that have been worked on, obviously this will help. After the surgery and once the grafts have shed, cosmetic attempts can be made to mask the redness in the recipient area, and you can use concealers and spray tans. The hair surrounding the donor area can be cut as low as a grade 4 and still conceal the donor wound once completely healed. Typically, a quarter to half an inch of existing hair is sufficient enough to assist the covering of the area at the back. Here are two pictures of immediately post-op conditions, just so you can kind of compare to what you're possibly going to look like given the area of work you require being performed. When will all the scabs go and the grafts shed? Another very common question. Once the grafts are placed into the recipient area, the grafts are held in by fibrin produced by a chemical reaction in serum when the graft sites are made. Typically, the grafts will become fully secure by the 8th day. Scabs will begin to form the day after surgery. On average, scabs will remain present for up to 10 to 14 days. If the scab falls out and there's a shaft present in the scalp, this is completely normal. As long as blood is not present and tissue does not appear around it to be in any way inflamed, assume the graft is fine. Once the scab has completely disappeared, you will just be appearing like it's a buzz cut. Within the next 2 to 6 weeks, these hairs will begin to shed and the recipient area will appear as if it was prior to the surgery. So it's kind of 3 steps forward, 4 steps back. The grafts are merely in a rest phase and will begin its growth cycle in approximately 3 months minimum. When and where do my staples come out? The staples or stitches, depending on the surgeon's technique, typically remain in place for approximately 10 days post-op. Surgeons encourage that you come back into their clinic to have them removed, but will provide you with instructions for removing them should a visit to the surgeon not be possible. A family member or local nurse can actually easily remove these staples or stitches, so don't worry. The scar will remain once the staples or stitches are removed and become less and less noticeable as the months pass and will eventually turn into a thin pencil white line. Soaking the donor area will moisten the scabs and minimize any discomfort you're feeling. The hair transplant journey is an emotional one with many, many ups and downs along the way. We refer to it as the hair transplant roller coaster. It's very important throughout your journey you stay positive, you refer to the notes in these modules, and they will keep you on track. Be very, very patient and be prepared to ride the hair transplant journey because it's really one well worth it.